32 days and the price tag grows by $311 billion. A new Health and Human Services report finding the health care law will drive medical costs up, not down. Republicans saying, "We told you so." HHS Secretary Kathleen Sebelius and the White House saying the report is lowballing the savings. But Gary B., what say you?
You know, Brenda, for months on this show and across, Fox News, Fox Business, we've been saying there is not going to be a pony under that Christmas tree. And I'll tell you what, this report proves it. And I'll tell you what, I'm even skeptical of this report for one reason. I think it lowballs that $300 billion deficit over 10 years. I think it's going to be 10 times that, as we've talked about, because that's the history of government involvement in this. And the rationale is easy and it's clear. The reason there's going to be such a deficit is that the demand will greatly exceed the supply already. Some employers are talking about getting rid of their company health insurance, because it's going to be cheaper, if you will, for them just to shove their employees onto the government insurance. The demand will greatly exceed supply. Costs will be up across the board. I'll tell you what, this is going to be a bigger mess than even this report says.
Well, Mark, this is the president's people. They're the ones who are saying this.
All you have to do is read the report to understand there's nothing wrong here. Here's what the report says. It says that if you're currently uninsured, you're going to have to pay some more money, but you know what? You get health care for it, so that's a pretty good deal for you. If you are currently insured, you're going to save money. You're going to pay less for health insurance. That's good for people who currently get health insurance. You add all the numbers together, the extra money paid by the currently uninsured, 30 million people, and the savings for the people who currently are insured, and it finds that it's going to go up total 1% over 10 years, a negligible amount, but everyone's better off.
First of all, Brian, it was supposed to go down. Second of all, 1% usually turns into...
Yeah, look at the cost curve growth in Medicare since it was incepted, right? I mean, it's been a massive increase. And what's going to happen here is probably what's going to happen in Canada, which is that the wealthy people, they pay their taxes, but then they either leave to get health care elsewhere, or there's a black market in Canada. If you got enough money, you go see private doctors and you pay cash. If health insurance companies start losing the healthy and the wealthy, they start doing their own thing, the pool then only becomes people who are maybe ill or not taking care of themselves, right? Obesity is a major problem. Guess what happens then? Costs skyrocket for everybody.
Does this scare you?
Well, yes, it scares me for a couple of reasons. One is, as an employer, already we'll take our people and put them off our plan because it just doesn't make any sense for us to pay the rate. Now, what happens is when they go on a self-funded, they go buy their own insurance from Blue Cross Blue Shield. Unfortunately, the government has mandated in this plan that they get this Cadillac plan that all stuff that they really don't want, but they will have to pay for. It's going to be cheaper for them to pay the $700 or $1,000 fine than it will be to take this stuff. However, when they get sick, they'll jump into the insurance because we have to take them. And then the studies say that 2,300% higher expenditure for those people who jump out. So they're going to game the system.
Pat, you've been saying all along that cost containment is not the reason for this bill. It has not been considered. Does this surprise you, this report?
Not really, because again, the focus was increasing coverage. You can argue all day whether that's a good thing or a bad thing, but that was the focus. The focus was not on attacking the root issues, such as the piecework away that health care is paid for here in the United States, tort reform, all the various issues that really drive up the cost curve over the long run. Nothing fundamental about cost saving was ever on the table, simply because the system is so broken. To really address the root causes, you have to blow it up and start over, and no one was willing to do that.
Well, Mark, name one agency that has cost less than it was originally budgeted for.
Well, we have inflation, we have population growth. That grows over time. But let me tell you why people are going to save money.
Okay,
I guess that's a no.
That's a no. You don't know.
Good answer.
All right.
Okay. All right. At least admit it. Come on.
I've said this in the past, though. This is not going to be a Republican-Democrat issue, guys. I think this is going to be, in the long run, it's going to be old versus young. I think that's what's going to happen.
Is.
The demographic trends are, striking. You got 80-year-olds, who want hip replacements paid for by Medicare, just no matter what they have put into the system. And eventually somebody, and maybe in some ways, the president and his staff is correct. At some point, cuts have to come, because if you look at the cost curve with the aging U.S. population, it is going to be nearly impossible to pay for this.
Yes.
We forgot to tell Brian he can only use 2-syllable words on this show.
Did he say cost curve?
Sullivan, does that mean I'm off?
Okay, last word, Gary V.
Well, I'll tell you what, you summed it up perfectly, Brenda. Once the government gets involved, costs go up. Brian said it. Medicare, Medicaid, Social Security, forget it. This is another way of bankrupting 1/5 of the economy. It's coming to your town soon.
All right, thanks, guys. Uncle Sam is